Welcome back. A big reason behind Minnesota's new COVID restrictions is the status of their hospitals. WCCO's Jennifer Mayerly spoke with healthcare providers about the stress on the system.
We 100% need these measures. Otherwise, the results will be catastrophic for Minnesotans.
Cardiologist Dr. Rebecca Cogswell is one of more than 1,000 healthcare workers who signed a petition in the last 24 hours delivered to Governor Tim Walz backing new restrictions. Hospitals and staff are strained, and doctors say without them, the immediate outlook is dire.
The normal triage mechanism where you have some, stratification of who needs to be seen first completely falls apart, and it's like you're in a war zone.
One day last week, she says a Twin Cities ER feared they'd lose a patient because of the strap system.
The patient was having intestinal bleeding and collapsed on the ER floor. Well, that could have been prevented.
Minnesota Hospital Association CEO Dr. Rahul Khurani says they're reaching capacity to care for COVID patients, plus trauma and other illnesses.
We have rooms, we have beds. What we're really worried about now are our nurses and our physicians who are getting COVID-19 in the communities.
He reports 7,000 plus were out one day last week for COVID or quarantine.
The capacity that we talk about now is care capacity. It's not the spaces.
Dr. Dimitri Draconia, chief of infectious disease at the Minneapolis VA, says for the first time in his nearly 20 years there, the VA is taking and treating patients who are non-veterans.
You really need to know that this is bad. We have not seen our health system in this much stress ever in our careers.
He calls it an overwhelmed system.
This is not us scaremongering. This is us seeing a wave coming towards us that we really hope we can survive.
Jennifer Mayerly, WCCO 4 News.
A statewide command center decided hospital capacity is in use right now. It coordinates care for hospitals across Minnesota to find a place for people who need it. And there's more COVID vaccine news this afternoon. Oxford University and AstraZeneca have released early data from phase 2 trials. The study of 560 adults found the vaccine is safe and triggers an immune response in adults of all ages, even those 70. In fact, older people had fewer side effects from the vaccine than younger adults, including tenderness, redness, and swelling at the injection site. Phase 3 trials will assess how well the vaccine protects against COVID-19.